Arhan is I'm Dr. Sukanya and pediatric nephrologist. Arhan Kalra is a 12-year-old boy from northern part of India, and he came to us for kidney transplant. Arhan had already undergone a first kidney transplant 6 years back, and because that kidney failed, he had come to us for a kidney transplant now. The main challenges in Arhan's kidney transplant is because அவருக்கு வந்து venous access பெரிய ரத்த குழாய்கள் சொல்லுவோம் கிட்னி டிரான்ஸ்பிளான்ட் பண்றதுக்கு அந்த ரத்த குழாய்கள்லேயே ஒரு பெரிய கிளாட்ஸ் இருந்ததுனாலும் அது சரியா வளராதனாலையும் we had major problems both in giving him dialysis ஒரு adequate ஒரு dialysis before transplant கொடுக்கறதுலயும் நிறைய challenges இருந்தது and also ஒரு kidney transplant அந்த கிட்னியை வைக்கிற இடத்துல எந்த நரம்பு குழாயில அதில் சேர்க்கலாங்கிறதுலையும் there was a lot of challenges with Arhan. But we were able to successfully do it because we had an expert team with intervention radiologist Dr. Ram, who helped us with securing a dialysis access, and also the expertise of Dr. Anil Vaidya is why they were here primarily, because we could do a complicated second kidney transplant in a child with almost absent abdominal veins. And now we have successfully done it, and Arhan is doing very well, and he has got normal kidney function. Post-operatively, Arhan is doing very well. He was in the hospital for around 10 to 12 days, and now he is perfectly fine with good kidney function. He has got good urine output. He's able to regain almost all his normal activities. He can eat normal food now, and he's able to consume good amount of water. And he's also slowly planning to go to school in the next 3 or 4 months.
What is the message you want to give to
the main message that we want to tell all of you is that kidney transplant in children, especially very young children, is no longer a very rare thing. It should be attempted. குழந்தைங்க ரொம்ப சின்ன குழந்தைங்களா இருக்காங்கன்னு சொல்லி கிட்னி டிரான்ஸ்பிளான்ட் அவங்களுக்கு ஒரு ஆப்ஷனா கொடுக்காம இருக்கக்கூடாது. It affects their overall growth, it affects their mental health, it affects their final height, it affects their performance in life itself. So kidney transplant is the best option for children of all age groups. Less than 10 kilos if we should attempt kidney transplant because it is much better treatment than dialysis, than staying on dialysis. So that is the main message here. And it's doable even in complicated patients like Arhan. Still, with a team like us, with a multidisciplinary team, it is always a possibility. And every child should have this opportunity at a normal life, even if they have kidney failure.
How long you have taken this procedure?
The procedure took us almost close to 8 to 9 hours because of its scale. Normal transplant would take around 3 to 4 hours in a child. But because Arhan's vascular anatomy is so complex and it's a second transplant, it took us close to 8 to 9 hours to complete the surgery and get the best outcomes.
Thank you.
I've been an intervention radiologist for the last 15 years. So, just to start where Sukanya ended, so patients who have renal failure, the definitive treatment is renal transplant. But not everybody is eligible for renal transplant. So these patients end up having dialysis until they find it suitable like a transplant. So in a normal patients, what we do is we perform the catheter placement or a fistula through veins which are in the neck. So we always say, the veins are very precious in these patients, you should take utmost care. In this case, because of these multiple interventions, all his veins in his neck are completely occluded. There are no veins in the neck, there's no veins in the chest. Unfortunately, he also does not have any veins in his groin. So basically, he was living with collaterals. So what happens is, when the main vein is occluded, body finds some collateral veins. That's how he's surviving. So to have a successful renal transplant for this kid, he needs to have some access. So what we did was, there's a 5 centimeter segment of the vein which was taken. So normally I've done these procedures in many adult patients, but this was the first time for a 12-year-old kid. We have to take that challenge. So everybody, when you see a dialysis patient, you'll see catheters in the front of the neck for the groin. For this kid, you have to go from the back of the next to the spine, using like advanced CT scans and everything. With anesthesia help, I think we were able to navigate the needle into that small segment of the vein. From there, we went into the chamber of the heart, and we were successful in placing this catheter. Technically, it is very challenging, but again, we have the expertise, and this is the only way for him to have his dialysis access. He still has the catheter because we just want to make sure the kidney is successfully working. And after a month, we are thinking of taking this catheter out. Not many would have performed this procedure, I think, at least in South India, I would say. I haven't heard. And this is an open discussion, so what we want to say is there is every chance these type of patients can get accesses if there is an expertise available in the hospitals. And it's also possible because of the pediatric nephrologist and the great surgeon like Anil Vaidya's team and Dr. Dinesh's team. Otherwise, he would have been like, he's from North India. So he came from North India to South India. And this is where everybody got together. We thought we should be successful in this case. And that's where we are today. Thank you.
Good afternoon. I'm Dr. Sendal working under Dr. Renal Re-Transplant. Unfortunately, he's not able to be here with us due to this personal emergency. So, coming to this kid, as everybody was telling, main problem over here now there is no venous access. For any transplant to be successful, for organ to be alive, we need two venous access. One is arterial inflow, which carries the oxygenated blood. The other is venous outflow, which carries the deoxygenated blood from the organ. So any transplanted organ will be surviving only when there is a proper inflow and outflow. So in the kidney, the main problem, as everybody said, because of multiple punctures for dialysis access, venous access full away thrombocytes. So normal adult kidney transplant will be done in the groin, what we call the pelvic fossa. Specific for the knee transplant, what we do is we do not disturb the first kidney that is failed. Usually we do it on the right side and then next time we go for the left side. Majority of times we will not go and try to remove the damaged kidney or diseased kidney. But particularly for this kid, we don't have any other venous access, so we have to go into the same place where the previous kidney was placed. And we have to remove the previous kidney and then preserve the old venous access. It is not a connection, we have to preserve that area, so only that is the option for us to give the outcome. So that was the challenge what we faced with this patient. So when we, once first surgery, when we go into the same place, there will be a lot of adhesions, it will not be a virgin place. So there will be a lot of damages to the surrounding structures. So we have to take extra precautions. So we went into the same position and then we removed the kidney, preserving the venous outflow of the previous one, and then we are able to do it.
அது ஓகே
நார்மலா உள்ள அனாட்டமி அவுட்ஃப்ளோ வரது நல்லா இருக்கு அப்படின்னா 6-7 டிரான்ஸ்பிளான்ட் கடை நீங்க பண்ணலாம். இவனுக்கு அரானுக்கு வந்து வீனஸ் ஆக்சஸே கிடையாது. ஸோ இதுவே ஒரு பெரிய சேலஞ்ச். இப்போ அவனோட யூரின் அவுட்புட் எல்லாமே நார்மலா இருக்கு. யூஸ்ஃபுல்லா டிரான்ஸ்பிளான்ட் பண்ண ஒரு 2 வாரத்திலேயே உங்களோட டயாலிசிஸ் கண்டிப்பா எடுத்துரும் இன்ஃபெக்ஷன். பட் அரானுக்கு கொஞ்ச நாள் ரீடைன் பண்ணி வைக்கிறோம். ரீசன் என்னன்னா, ஒருவேளை ஏதாவது ஃபெயிலியர் வரக்கூடாது, வந்ததுன்னா அப்போ திருப்பி டயாலிசிஸ் கண்டிப்பா போறது ரொம்ப கஷ்டம் தான். அதனாலதான் ரீடைன் பண்ணி வச்சிருக்கோம். ஒரு மாசம் கழிச்சு நல்லா இருக்கான்னு அந்த கண்டிப்பா இருக்கு. பிளஸ் நெக்ஸ்ட் டைம் அவனுக்கு டிரான்ஸ்பிளான்ட் தேவைப்படுச்சுன்னா இதை விட இன்னும் சேலஞ்சிங்கா தான் இருக்கும். ஏன்னா அவனுக்கு வீனஸ் ஆக்சஸ் எதுவும் கிடையாது. இதை விட இன்னும் சேலஞ்சிங்கா தான் வரக்கூடாதுன்னு.
सबसे पहले मैं गॉड का थैंक यू कहूँगा। उसके बाद जिन लोगों ने मेरे अच्छी ब्लेसिंग दी है उनका थैंक यू कहूँगा। और इंटायर टीम MGM Healthcare की सबको मैं थैंक यू कहूँगा जो जिनका अच्छा कॉपरेशन उनकी ब्लेसिंग्स मेरे बच्चे के लिए थी। और आप सब देख ही रहे, मेरा बेटा सामने सेकंड ट्रांसप्लांट किया है। कॉम्प्लिकेशंस बहुत थे क्योंकि उन्होंने चैलेंज एक्सेप्ट किया डॉक्टर अनिल सर ने, सुकन्या मैम ने, दिनेश सर ने और डॉक्टर राम ने, जो कि मतलब भगवान का नाम जैसे राम का है वो राम मंगी है जो उसने मेरे बेटे का कैथेटर लगाया है। नहीं तो मेरे बेटे का डायलिसिस भी नहीं हो सकता क्योंकि मैं नॉर्थ से आया हूँ और मैंने बहुत प्रॉब्लम फेस की है। फ्रॉम लास्ट 12 ईयर्स मैं प्रॉब्लम फेस कर रहा हूँ और आगे भी मैं ये चाहूँगा कि ही शुड बी फाइन एंड लिव हिज हेल्दी लाइफ। और इनकी टीम ने जो सपोर्ट और जो कोऑपरेशन दिया है मुझे कहीं नहीं मिल सकता। और मैंने कभी जैसे आया था कैडबरी में मेरा बच्चे का उन सबके लिए आप थैंक यू कहना चाहता हूँ।
आप कैसे आया आप
अरहान
कैसे हो
कारन
कैसे हो
ठीक है
अच्छा
सब कुछ खाना खा